Hi, this is Heidi Horvick from Horvick Research. This is a health talk example about the research about chiropractic care for kids, specifically aimed at a public audience. So to begin with, I would include a personal introduction about yourself. We really encourage you to make this talk yours, all about you and your chiropractic story and why you're doing what you're doing and why you're here today to give this particular talk to this particular audience. I have included a little bit of history about chiropractic and also the basic knowledge we now have about the effects of an adjustment, and you can of course include as much or as little of this as you like. And then after that, I specifically cover what the literature says about chiropractic care for kids and babies. The fact that you've come to this talk today means that you're probably curious about chiropractic care and how it can help you and your family. So let's explore what chiropractic is all about and how it works. A chiropractor is a healthcare professional who specializes in the health and function of the spine and nervous system. Now, I should point out at this stage that the principles that chiropractic is based on aren't new. In fact, the ancient Greeks and other early civilizations used spinal adjustments as a form of healthcare. Hippocrates, the father of Western medicine, apparently stated that physical structure is the basis for medicine and went into great detail concerning the importance of the spine for good health. Now, these principles were formed into a distinct approach to healthcare in 1895 in America by a man named D.D. Palmer. He opened a school 2 years later and the profession began to flourish and gradually spread around the world. There are now approximately 100,000 chiropractors worldwide and over 40 chiropractic schools in 16 different countries. The main focus of chiropractic care is on the spine, and therefore many people think that chiropractors can only really help with problems such as back pain, neck pain, and headaches. And while it's true that chiropractors can often help people in pain, there is actually so much more to chiropractic than just treating pain. Chiropractic care is really all about total health and well-being. It's about helping people to feel great and get the most out of life, functioning at their optimal potential. Now, to understand how this works, it's important to consider the spine's role in the body. The spine is there to protect the spinal cord, which is part of the central nervous system. The spine is like a set of armor made up of segments so that you can move and bend naturally with the body. A spinal segment consists of two vertebrae and the joints that connect them, and there's a disc in between each vertebra that acts as a cushion. Now, underneath that armor, a whole lot is happening. Messages travel from around the body, up the spinal cord and into the brain. The brain processes those messages and sends replies back down the spinal cord to tell the body how to respond. So the central nervous system is one big information highway, and it carries vital messages to every part of your body. Now, sometimes the wear and tear of everyday life can impact the spine and cause spinal segments to move in a way that's different to normal, in a dysfunctional way. That wear and tear can happen gradually, such as from bad posture, or it can happen suddenly, which is common with sports injuries. Because of the close relationship between the spine and nervous system, everyday strains can actually impact the flow of information between the brain and the body. Messages may not be delivered to the brain, or they may be inaccurate. When this miscommunication occurs due to abnormal movement of the spine, chiropractors call this a vertebral subluxation. You will hear me talk more about this term, so I want to make it clear what it is. So I'll repeat myself. A vertebral subluxation occurs when you have abnormal movement in the spine that interferes with the accurate flow of information between your brain and your body. I'll talk more about this later and why it's so important. But as a chiropractor, my number one job is to improve the function of your spine. By making fast, gentle adjustments to your spine, I can help restore the natural movement and improve the flow of accurate information throughout your nervous system. The way I see it is that your central nervous system is like the engine of your body. And as a chiropractor, I act as a mechanic, tuning the spine and central nervous system so that your body can run like a race car. Sometimes people often ask me when I'm adjusting them because there's a popping sound that occurs. I always like to point out early on in the piece that these popping sounds are completely harmless. They are just the release of gas from between spinal segments, and they are no more significant than any other release of gas from the body. You've heard me mention the central nervous system already. It's really important that you understand why I'm so interested in the function of your central nervous system. So I want to give you a bit of background information on how your brain and nervous system works. Did you actually know that your brain and central nervous system are constantly changing? It's quite amazing. From one day to the next, your brain is not the same. And this is what scientists call neural plasticity. So what's causing this change? Well, to start with, your brain is receiving a constant supply of messages about your body and the external environment from your sensory organs. That's your eyes, your ears, your nose, your tongue, your skin, and so on. With all of this information, your brain maintains a 3D map of your body and keeps tabs on what's going on inside and outside of it. Your brain needs to interpret all of this data from your senses. It translates the information you received based on what it's learned from your past experiences as well as what it expects for the future, its preferences and more. You could call this the brain's bias. There's basically a whole lot of background processing that happens under the radar. The interesting thing here is how you or your brain sees a situation may not be entirely accurate. Sometimes your brain even fills in the blanks on your behalf. So this means that your experience isn't necessarily 100% based on reality, but is instead a perception of reality. Now let's look at an example of how the brain fills in the blanks. Look at this picture and consider which square is darker, square A or square B. Which square is darker now? They're actually the exact same color. It's incredible, isn't it? Your brain does not just see what the eyes tell it, it interprets what the eyes tells it based on other information that's already stored up. In this case, you can see square A is darker than square B because square B is in the shadow of the green cylinder, while square A is outside the shadow. Now, based on your brain's past experience, it will decide for you that if a square in a shadow reflects the same amount of light as a square outside the shadow, then it must be a lighter shade of grey. Another example is this swirling colourful image. The colours between either the orange lines or the purple lines is actually identical, but it looks like two different colours, blue and green, because the brain only sees colours in contrast. This means that your brain will tell you what colour you see based on what colour it's next to. This can make the exact same colour look completely different depending on the colour that it's next to. So have a look when we just take out part of this picture and then cover up the orange and purple and place the two images close to each other. Now we can see that they're in fact the same colour. It's pretty amazing, isn't it? And here's another example. The brain doesn't just look at surrounding colours of things, but also the surrounding shapes. We can see this clearly in this image. Believe it or not, those two orange dots are actually exactly the same size. The problem is when the brain sees the orange dots surrounded by larger blue dots, it makes the middle orange dot look smaller than the same sized orange dot if it's surrounded by small blue dots. Now here you can see the orange dots without the surrounding blue dots, and as you can see, they are absolutely identical in size. This is because our brain does not just see what we're looking at, in this case the orange dots, but it also takes into account the surrounding information, like the smaller or the larger blue dots. It then creates for us what it thinks we need to know, our own virtual reality. Now this ability of the brain to fill in the gaps and create our own perception of reality can become a problem for you if your brain is not accurately perceiving what's going on inside and outside your body. What happens, for example, if the brain's map of the body is inaccurate, or if it's interpreting information based on faulty perceptions? Well, it may mean that your brain doesn't respond to environmental cues effectively. But how would you know if your brain's map of the body or knowledge of the environment was inaccurate? Well, you might find that you become a bit clumsy, or that you stub your toe often, or catch your elbow on door frames, or you might find that your golf swings out, or that your concentration just is not what it used to be. Or you may find yourself overreacting emotionally to a situation. This is when chiropractic care comes into the picture, because of the vertebral subluxations that I spoke about earlier. They can alter the way the brain perceives information from your body and the environment. So by correcting the vertebral subluxations, chiropractors can help restore the function of your brain and central nervous system, improving the accuracy of your brain's map of the body so that you can operate at your best. Let me explain this in a little bit more details so it maybe makes more sense. We know that our brain receives information about our body and the environment from your sensory organs such as your eyes, your ears and your nose and so on. But did you know that the muscles of your body are also sensory organs? So when your body moves, muscles are stretched and this information is sent to your brain so that your brain knows where your body is. When you think of your muscles, you probably think of your biceps and triceps, and you wouldn't necessarily think of the small muscles closest to your spine and skull. But these small muscles do in fact play a very important role. They tell your brain what your spine is doing, which represents what the core of your body is doing. Remember that you cannot actually see your spine, so your brain has to rely on the sensory information from the little muscles close to your spine and skull. However, if your spinal segments begin to move in a dysfunctional way, for example due to an injury or bad posture, then that communication between your spinal muscles and your brain becomes distorted, which means you have a communication breakdown between your brain and your body. And this is exactly what happens when you have a vertebral subluxation in your spine. So if you have vertebral subluxations, it may cause background noise for your brain, so your brain might not be able to get adequate information about what's going on in your body, and it will therefore have to fill in the blanks. Let's explore this with an analogy. Imagine for a moment that you've lived in a house all your life. And in this house is a long corridor. At the end of the corridor is an electrical fuse box. Now imagine that the circuit breakers to the lights have blown and you are pitched into complete darkness. Would you be completely helpless? Or could you walk down that corridor and turn the circuit breaker back on again? Well, of course you could. You've lived there all your life. You would know roughly how long the corridor is and how wide it was. You'd be able to get back down there and turn the lights back on. And your brain is just as smart as that. It can function even if there's parts of your body that it cannot see. It will be able to function and control those parts of your body because of your past experiences. But now imagine that before those lights went out, your kids had left a bicycle in that long corridor and that you hadn't seen that. What would happen in that scenario? Well, you would likely fall and hurt yourself. And that's what can happen when your brain is not fully aware of what's going on somewhere in your body. You could end up having accidents or hurt yourself. And this is where your chiropractor comes in. A chiropractor will gently adjust any dysfunctional spinal segments, these vertebral subluxations that I keep talking about, to restore healthy movement. And this can improve the communication between your brain, your body, and the environment. It's actually a lot like rebooting a computer. You get rid of all the glitches. When your brain can accurately perceive what is going on inside and out, it can control your body better for the situation at hand, and then move the muscles in the right order and so on. This means that your body moves accurately, you have fewer accidents, and you can function and perform at your best. So chiropractic care is all about improving the function of your nervous system so you can function at your optimal potential. Although it's my goal for patients in my practice, I know that a lot of people, when they first come to see me, it's because they're in pain. What I always want to point out to them is that it's important to understand that troublesome symptoms and pain don't appear out of thin air. They build up over time, like the analogy of straws on a camel's back. Hundreds of straws are stacked up over time, yet with the addition of the 1,000th tiny straw, the camel's back suddenly breaks. And it's the same way with symptoms. The problem can build up unnoticed over time, and then suddenly symptoms make themselves known in a big way. And a symptom is really only like the tip of an iceberg, with a much bigger problem lying under the surface. After all, a symptom's just a symptom, it isn't the cause. Symptoms are a bit like the alarm bell going off, to warn you that there's a problem. The fire alarm is not the problem, the fire is. So don't turn the fire alarm off and ignore the problem. Go find the cause and put out the fire. So when patients come to see me, I always let them know that for chiropractic to help them, it may take a number of visits. If their problem took time to build up to the level it is today, or they've been subluxated for a long time, well, more often than not, it will take some time to resolve it too. So it's also important to understand that symptoms may be due to dysfunction in a part of the spine that seems unrelated to the problem area. I want to give you an example about this. It may be that you've got pain in your left knee. It may be hard to imagine that this pain in your left knee could have anything to do with your spine. But if your spine is not moving properly, it may be interrupting the flow of information from your leg to your brain and back again. It may be that your brain is not accurately aware of what's going on in your knee. And because of this, your leg may be receiving faulty messages from your brain, which means that your knee moves in a less than ideal way. And poor movement sustained over time can often create an imbalance in your body and may cause pain. So remember that your body is one interconnected system. No one single part operates in isolation. And the objective of chiropractic care is to restore healthy communication throughout your body and to maintain that communication over time, leading to better function, less accidents, and a healthier you. So bearing this in mind, when do you think it's a good time for someone to first get their spine checked by a chiropractor? Since chiropractic care is all about restoring healthy communication throughout your body, when do you think that communication can first be impaired due to a subluxation in your spine? Well, the simple answer is the day you're born. Issues like intrauterine constraints, which is all about the forces within mummy's tummy restricting normal movement for the baby while it's growing and developing, through to the birth process itself, can all place a lot of pressure on a baby's spine. Sometimes this can mean that a baby's first subluxation even occurs before they're born. So it makes perfect sense to have a baby's spine checked as soon as possible. I certainly think so, and there's even research to show that even our youngest members of our family can benefit from chiropractic care. Now, one question I'm often asked about by parents of newborn babies is whether or not it's safe to adjust their baby. The short answer is yes, it's very safe. I know I've never felt that there was any chance I was going to do any harm to the hundreds of babies that I've adjusted. But don't just take my word for it. Over recent years, a number of researchers have investigated the safety of chiropractic care for children and infants. And these studies overwhelmingly suggest that chiropractic care can be safely provided to even our youngest members of our society. In these studies, researchers have reviewed all the published literature relating to chiropractic care for infants and children to see how common adverse events are in our youngest patients. What they found was that adverse events in children receiving chiropractic care are very rare and generally involve short periods of muscle soreness that resolve without requiring any further treatment. About 1 in every 100 or 200 younger chiropractic patients report feeling sore after their adjustment. Serious adverse events associated with chiropractic care, though, are extremely rare and tend to occur in children who have significant pre-existing health issues where the chiropractor didn't modify their technique appropriately when caring for the child. So what does this mean to you? Well, put simply, parents can feel secure in the knowledge that chiropractic care is safe for children and infants, and it is very safe compared to most other healthcare options. And it's especially true when a proper history and exam is taken and the chiropractor modifies their technique approach to suit their young patient's spine. Of course, some risks do exist, but when modern chiropractic care is appropriately applied, it is very, very safe for all members of our society, irrespective of their age. So it's great that chiropractic care for kids and babies is safe, but the next question is it effective? Do kids really need to get checked by a chiropractor? Well, healthy communication throughout your body has got to be a good thing, whether you're a newborn, a teenager, an adult, or it's your 100th birthday. But again, don't take my word for it. Let's look at a couple of research studies that have shown some really good benefits associated with chiropractic care for babies and kids. The first study I want to talk to you about looked at chiropractic care for babies with colic. I'm going to play this short video for you that describes the study very nicely. When you are making the exciting preparations to meet your new baby, most parents are realistic about the fact that there'll be some tears along the way. Crying comes with the territory. But for some, the reality can be a lot more intense. 10 to 30% of all young babies suffer from infant colic, which is an unexplained condition that causes excessive crying in otherwise healthy babies. There is no known cause and few solutions. Being unable to soothe your inconsolable baby can obviously be quite distressing. Aside from being stressful, tiring, and even heartbreaking for parents, infantile colic can be a cost burden to our society in terms of healthcare resources. The good news is that there are some things that you can do to help soothe your baby. There are many studies that have shown that chiropractic care can significantly reduce periods of crying in colicky infants. Let's take a closer look at one of these studies. Conducted in the United Kingdom in 2007, the researchers wanted to find out how effective chiropractic care was for babies who were experiencing unexplained crying. 104 babies, 8 weeks old or younger, were able to participate in this study between October 2007 and November 2009 at a chiropractic teaching clinic. They were randomized into 3 groups. The first group of babies were given chiropractic care, and their parents were aware that this was happening. The second group also received chiropractic care, but their parents didn't know whether their baby was receiving care or the control intervention. And the third group didn't get checked by a chiropractic student. Instead, they received the control intervention, and their parents also didn't know whether their baby was receiving care or the control intervention. Over a 10-day period, the parents completed daily crying diaries, documenting their baby's behavior. The first and second group of babies who were receiving chiropractic care were individually examined and given gentle spinal adjustments where required and as often as needed. If we take a look at this graph, this side is the average change in crying time, measured in hours, and down here we see the number of days, so up to 10 in all. We can see here that the babies who didn't receive chiropractic care still saw a reduction in crying time by about an hour less. But now look at the babies who did receive chiropractic care. They've fared significantly better, with up to 3 hours less crying time in some cases. Researchers found that both groups of babies who received chiropractic care responded equally well. We can see here that the babies who did get chiropractic care are crying on average 2 hours less each day after 10 days of care. This is a significant reduction in crying, especially for the potentially frazzled parents. Interestingly, it didn't make a difference whether the parents knew that their baby was receiving chiropractic care or the control intervention. This confirms previous studies that have also shown babies with colic respond well to chiropractic care. It means that the child's improvement is probably due to the chiropractic care itself and not parental bias or the parent placebo effect. This study found that excessively crying babies were at least 5 times as likely to cry significantly less if they received chiropractic care compared to not receiving care. So it's very likely that chiropractic care really does help babies who are suffering from colic. The chiropractic care that was given to these babies in this particular study was also performed by chiropractic students under the supervision of fully qualified chiropractors, and their care had some remarkable results and made a real difference to the families involved. So imagine what a fully qualified and experienced chiropractor could do to help you and your family. And here's another study where we can look at what happens with chiropractic care for babies with bedwetting. As parents, you would have discovered that your child occasionally wet their bed at night, but usually this is something they grow out of by the time they're about 5 years old. But for some kids, this does not happen. For some kids, this persists, and this is known as nocturnal enuresis. Not only is this frustrating for parents who have to change wet beds night after night, but it can also cause a host of additional problems for the suffering child. Some are devastated by their parents' disapproval, and some are teased by their siblings. Some of these children suffer greatly from low self-esteem that can have a major impact on their mental and emotional well-being. If this wasn't bad enough, many of these children struggle with their social life and miss out on sleepover parties and school camps to avoid other children finding out about their bedwetting problems. So why might chiropractic care help these children? Well, we know that gently adjusting the spine changes the way the brain perceives what's going on in the body, so improving spinal function with chiropractic care may help the brain and central nervous system to notice that the bladder is full and wake the child at night. So what does the research evidence say? Unfortunately, not a lot of research has been done yet in this area, but there are many individual cases published in the scientific literature suggesting that chiropractic care may help at least some children with their bedwetting. And in 1994, a group of researchers performed a clinical trial including 46 children who frequently wet the bed at night. They measured their bedwetting frequency for 2 weeks and then divided them into 2 groups. One group received 10 weeks of chiropractic care from final year chiropractic students, and the other group received a sham control intervention or pretend chiropractic care. They then measured their bedwetting frequency for another 2 weeks after the 10-week intervention period. So what did happen after 10 weeks of chiropractic care? The researchers found that after 10 weeks, the children receiving chiropractic care had on average almost 2 more dry nights over a 2-week period. The kids who did not receive any chiropractic care had no change in the number of nights that they wet the bed. This does not sound like much improvement, but when the researchers took a closer look at the results, they found that 25% of the children who received chiropractic care actually had a 50% or more reduction in wet nights over the course of the trial. None in the control group had this kind of improvement. This suggests that chiropractic care may well help at least some children with their bedwetting, while for others it doesn't help much. But for those kids that it does help, it helps a lot. Remember that the chiropractor isn't directly trying to treat the bedwetting. Instead, they are trying to improve spinal function with the aim of improving your child's brain's ability to process what's going on in their body And for some kids, this seems to result in more dry nights and improved bladder control. So if you know of children suffering from bedwetting, share this with their parents in case they also want to try chiropractic care. When appropriately applied, chiropractic is known to be safe for kids and babies. And we know from this study that for at least some children who wet their bed at night, chiropractic care really seems to help. So it's worth giving it a go, because it's not just about the dry nights, but it's also about the child's mental, emotional and social well-being. So as you can see, the research suggests that chiropractic care really can help kids and babies. And there are many, many more research studies that demonstrate all sorts of benefits from receiving chiropractic care. These studies have generally been done in adults, but an adult spine is just a bigger version of a child's spine. So we can assume that at least some of these benefits will apply to all. Visual acuity and visual field size improvements, reaction time improvements, brain processing improvements, joint position sense improvements of elbows and legs, spinal function, leg strength in your leg muscles, and prevention of muscle fatigue, and so on and so on. So the take-home message from my talk today is that chiropractors aim to correct spinal function to improve the flow of information between your brain and your body, so your body can run like a race car, so you can function at your optimal potential. Choose chiropractic care for yourself and your family, and aim for healthy living from the day you're born. Now I'd recommend you finish up with your own conclusion and your own call for action. Like, what would you like the audience to do now? What action would you like from them? If you want to mention or not that this talk is based on many research papers, in particular the work relating to neurophysiological effects of chiropractic care from Professor Bernadette Murphy's lab in the University of Ontario Institute of Technology in Canada, and Dr. Heidi Horvick's lab at New Zealand College of Chiropractic, the Centre for Chiropractic Research, and other key contributors are Dr. Kelly Holt, Dr. Imran Khan Niazi, Professor Paul Yielder, and other key collaborators that I've worked with, such as Professor Kemal Turker from Koç University in Istanbul in Turkey, and Dr. Dina Lalic and Professor Asbjørn Drews from Aalborg University Hospital in Denmark. And then you may want to include the bibliography slides, and this is totally up to you. We've included them all there for you in case you wanted to give it away as a handout, and in case any of your members that were listening to this talk are interested in following up any of the information that you've talked about. I hope this helps enlighten the world about the science of chiropractic, and together let's change the way the world views what chiropractic is and does.